So we at Shine Family Chiropractic love to facilitate nervous system specific care. And we're family chiropractors because when we focus on the nervous system, when we focus on listening to the body and asking it where it wants certain inputs, we can work with any age, whether it be an old person on their way out or a new baby that has just made his way into this life. A lot of times in the beginning with the newborn babies, I'm just listening and doing what is called tonal chiropractic care, where I'm listening with my hands and doing just light touch and connecting little points. And it's so cool because you watch this little baby on the table move and wiggle and watch that nervous system integrate and adapt and release spinal cord tension on its own. Then anywhere that the baby gets stuck, I can do what is called a sustained contact, where I will lightly hold a point, not more pressure than what would bruise an apple, right? So it's not a lot of pressure, whether it be up here on the top or down in the sacrum. The sacrum, obviously this is a big sacrum, but a baby would have a small one. Sacrum is down here. That's a really, really important part for the baby to be able to digest, because the parasympathetic nerves from here go to the front in the lower digestive tract. So a lot of times babies that get backed up, that get colicky, can have a sacrum or an atlas, and usually it's both. They have atlas and sacrum subluxations, which is creating nerve interference and dysfunction for their parasympathetic systems, the rest and digest function. So a lot of times I'll hold the leg and I'll just kind of shimmy that sacrum, right? I'll just do kind of a sustained contact here. Sometimes I can use my activator instrument on the lowest setting, or maybe like a 2 setting, so maybe a little bit of input right here on that baby sacrum. It's a very, very light, specific tool to just get a little bit of input in so that the brain can become aware of that joint. Sometimes when the baby's a little bit older, we can motion palpate in and see if the nervous system in the system is open to put a slight little just set into the sacrum. And a lot of times that's a very, very welcome input to get that input into the SI joint, stimulate the brain to reconnect with the parasympathetics down there in that lower digestive tract. So stay tuned. I'll talk a little bit more about how we adjust toddlers and older kids.